Hey, good morning, everyone. My name is Jeremy Self, and I'm a member of LT Senior Services. LT Senior Services is designed as a Lake Travis resource to serve and engage aging adults and their families. We're missing our fearless leader today, Cindy Cummings, and we wish her well as she's away. For 2022, we have a variety of nonprofit and business members. Our goal is to help older adults, and we do that by offering educational events like we are doing today. We offer shred days to aid in shredding personal documents, which is coming up only 1 week from today on Tuesday, October 18th. So if you want to bring your documents, we'll be in the shopping center of Lakeway Aquatics at Lakeway Commons Shopping Center, where Firehouse Subs and all of those things are, and we just do that by donation only. So we hope that you'll join us. And then our annual Aging Well Expo, we had over 150 people join us. And so we were so grateful to have everyone participate in that. And then we also have a website that you can get additional information from anytime that you would like. Now, some projects we hope to work further on in 2022 are property tax exemption assistance and emergency preparedness. Our next webinar is going to be on November the 8th, and that's going to be Dr. Carlson from Be Well MD. And they're going to be talking about current healthcare topics for seniors. They're going to provide lots of information, answers, and solutions. So at this time, we always like to introduce our Lake Travis Senior Services members who've joined us on the webinar today. And so we'll bring them on one at a time and ask you if you could introduce yourself and try to keep it to about 30 seconds. Tell us who you are and what you do. Do we have any guests
Jeremy,
today?
I'm not seeing any.
Okay. All right. Well, then we will advance on. So our guest speaker today is Scott Gidley. Scott is the president of Charitable Financial Partners. He's a long-term resident of Lakeway. He's actively supported our community by serving on boards, task force committees, fundraising for scholarships, teacher grants, different Lake Travis Independent School District organizations, youth sports, volunteering with several local nonprofit organizations, and coaching and refereeing and umpiring LTYA sports. Scott and I have a lot in common in that way. Scott's wife, Beth, is a retired banker who is enjoying being a grandmother, and his two daughters attended and graduated from Lake Travis High School, and they've been employed as teachers at LTISD. Now, Scott enjoys the diverse lifestyle opportunities of our Lakeway and Lake Travis communities, and he enjoys walking in our beautiful parks. With over 30 years of experience in financial services, Scott is the president of Charitable Financial Partners, a local financial firm that provides objective and independent Medicare insurance planning advice, which we'll get to hear about today, as well as comprehensive wealth management services. Annually, Scott supports several local organizations. So I'd like to welcome Scott and have him share what he's going to be educating us on today.
Thank you, Jeremy. I appreciate that introduction. And a lot of people will ask me, what is the meaning of Charitable Financial Partners? And I adopted the concept of charitable because State Board of Insurance will allow me to make charitable donations based on insurance commissions that I earn from selling and providing insurance services. So annually, my wife and I will sit down and essentially we'll dedicate 10% of all earnings that I make from the sale of insurance products, including Medicare insurance products, to local charities. So that explains Charitable Financial Partners. I know many people have asked me about that. So I appreciate the opportunity to talk today and share with you just some ideas about some of the major changes that are occurring with Medicare in 2023.
That's great.
I'm not
And
seeing.
will
I'd like to make a presentation based on a PowerPoint that I shared. So if we can start the PowerPoint presentation, that'd be great. And I'm not seeing it. So are we on, what page are we on?
We're working on it, Scott.
Okay.
It should just be a second.
Okay. Let's advance. I've not commented on that page. Changes to CMS guidelines. Recently, the CMS released their final rules, which includes 2 requirements for independent agents and brokers who sell Medicare Advantage and Medicare prescription drugs. And they go into effect in calendar year 2023, but they become effective on October 1st, which is prior to this year's annual enrollment period, which is October 15th to December 7th. And really the purpose of these changes and these guidelines are, I'm sure all of you have seen on TV, J.J. Walker and Joe Namath and William Shatner and others touting all of the things about Medicare and how we can save you money and do this and do that. These are really misleading TV commercials and marketing tactics by third-party marketing organizations because not all of that applies to residents in our county. It's just kind of a general sensationalized advertising, if you will. And because consumer complaints have doubled, more than doubled in each of the last 2 years, CMS, the Centers for Medicare and Medicare and Medicaid Services, have decided that they need to put some rules and regulations on that. What we found is the consumer satisfaction isn't so much with the independent agent, but it's with these third-party marketing organizations. And probably all of you have been contacted by the phone, received tons of mail, but the robocalls will basically try to solicit an interest on your part, and they will then sell your information to Medicare insurance organizations, agency organizations to contact you by phone or by mail. So I guess it's buyer beware, consumer beware, and know that because of this, the CMS has created some guidelines. So let's go ahead and advance to the next page. New call recording requirements. TPMOs, third-party marketing organizations, by definition, they included independent agents and brokers. So I, as an independent agent, and other agents and brokers must abide by these new rules. That basically says we must record all of our outbound and inbound phone conversations, which we make with beneficiaries, Medicare beneficiaries, whether they're new or existing clients, during the entire enrollment process for Medicare Advantage and prescription drug plans. Now, these recordings, they're supposed to be maintained in a HIPAA compliant manner for a 10-year period. And your agent will need to let you know right from the start, it needs to preface it with, for quality assurance purposes, this phone conversation is being recorded to protect you. Now, you as a consumer can say, I consent to this recording, or you may choose not to consent. So that's up to you. There's also a new disclaimer requirement. The TPOs, we have to say in the first minute of all sales calls, any communications we have with consumers, we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all your options. For any Medicare agent that is properly licensed and certified with all plans in your area, this regulation does not apply. But frankly, it is very, very uncommon for a Medicare agent to be licensed with each and every Medicare insurance company in the county. There are some smaller companies, nondescript companies that they're viable, but I, for instance, am licensed with probably about 10 in our county, and there are probably 15 that offer products and services. And I just made that choice because those 10 are the top 10, the top brand names, and probably offer the multitude of products and services that you as a consumer are looking for. Now, there's also lead generation activities, and basically any sort of lead generation activity that we participate in, we must include that verbal, written, or electronic notice to you that the information that we get from this lead generation source can be shared, may be shared with a licensed agent for future contact. So let's go ahead and advance to the next page. A couple of the changes that have occurred involve the election period process. IEP is known as the initial enrollment period. It's a 7-month window. The month in which you turn 65, the 3 months before, and the 3 months after. So if currently, before this change, if you sign up for original Medicare Part A or original Medicare Part B, and A is hospitalization, B is doctors and outpatient. And if you sign up in the 3 months before you turn 65, the effective date of your Medicare insurance would be the first day of the month in which you turn 65. The previous rule stated that if you sign up in the month in which you turn 65 or any of the 3 months thereafter, your effective date would be 2 months after the month in which you sign up. In 2023, if you sign up in your birth month or if you sign up in those 3 months afterwards, the effective date of your coverage will be the first of the month in the month thereafter. And that really is I think, a much more efficient process. It's an effective process. It enables you to have your effective date of your Medicare insurance coverage the first day of the following month, which could help with you're not being covered for a month or two, or the possibility of you're incurring a late enrollment penalty, which would exist for the rest of your life. They also got the general enrollment period, known as GEP. Basically, that runs from January 1st to March 31st and states that if you have made a mistake or you want to make a change to how you signed up for your Medicare during your initial enrollment period, during January 1st to March 31st, the previous rule stated that your effective date would be July 1st. Again, that causes a delay in coverage and potential delay, which could cause a late enrollment penalty. So the new rule states that if you sign up or if you make these changes during January 1st to March 31st, the change, your effective date, will become the first day of the following month. Let's go ahead and advance to the next page. Here's some other changes, and you know, they're probably more than just this, but I'm trying to touch on some of the major ones. Kidney transplants, immunosuppressive drug coverage. Previously, Medicare would offer this coverage for a 36-month period, but now they're saying that they'll have to pay for these drugs beyond 36 months after a kidney transplant if you don't have any other health coverage. The second point is removal of cost sharing for adult vaccines. There are a handful of vaccines that are commonly taken by adults. And one of the most notable ones that changes this year is shingles. My wife and I did our shingles vaccine about 3 or 4 months ago, and we had to pay $47 for it. That being said, I would recommend that you consider going to your local pharmacy for the shingles injections as opposed to going to your doctor. And I'm not trying to say don't go to your doctor, but I'm just trying to point out that if you go to your doctor, the total cost of having that vaccine, as well as your office payment, your co-payment, will be substantially higher than that $47. But starting January 1st, the shingles vaccination is now zero. There are also lung cancer screenings. Medicare will now cover lung cancer screenings if you meet all of these following conditions. Your age is 50 to 77. You don't have signs or symptoms of lung cancer. You're either a current smoker, you quit smoking within the last 15 years. You have a smoking history average 20 cigarettes per day for 20 years, and you get an order from your doctor. Let's go ahead and advance to the next page. Well, I see my columns aren't very well aligned here, but I think we can still read that. Part A, as I said before, is inpatient hospitalization and facility coverage. If you have worked for 40 quarters or more in your life and have paid Medicare taxes withheld, you pay zero for your Part A Medicare. Now, as I put down below, the spousal benefit applies for Part A, and that is if your spouse, your husband, your wife, satisfied this condition and worked for 40 quarters or more, but you didn't, you are still covered under this same rule here that you pay zero if it's 40 quarters or more. Now, a change here, and I'll pull this out and read this. Last year, it was if you work 30 to 39 quarters, your monthly premium for Part A would be $274. In 2023, that figure will be $278. If you worked 30 or fewer quarters in 2022, that monthly premium was $499. That is now $506. And let me say that these changes just became public in the last couple of days. And if any of you would like a copy of my PowerPoint with the updated figures for 2023, you can let Natalie know, or I'll give you my email address at the end of this presentation, and I'd be happy to send them to you. Your inpatient hospitalization, the deductible in 2022 was $1,556. Effective January 1st, 2023, that figure is $1,600. Days 1 through 60, your coinsurance is still zero, no change there. Days 61 through 90, the coinsurance has changed from $389 a day to $400 a day. With regard to your days 91 and plus, you're offered up to 60 days lifetime benefit there, and that figure then becomes $800 a day, not $778. With regard to skilled nursing facilities, days 1 through 20, coinsurance is still zero. Days 20 through 2021, days 21 through 100, your coinsurance figure is increased from $195 to $200. Let's go ahead and advance to the next page. Now, whereas the spousal benefit applies for your Part A coverage, it does not apply for original Medicare Part B, and that's outpatient and doctor coverage. Last year, the base monthly premium was $170.10. This is a substantial increase from the year before. In 2021, it was $148.50, and it went to $170.10. Largely because there was anticipation that there were going to be some specialty drugs, particularly Alzheimer's drugs, that were going to cause increases that would necessitate this base monthly premium go up. What they found, though, that was the actual cost of these Alzheimer's drugs were lower than what they anticipated. So consequently, the base monthly premium in 2023 is $164.90. So it's gone down about $5. So we can all be happy about that. You probably have seen, but just try to simplify the concept. There's an income-related monthly adjustment amount, which goes by the acronym IRMA. What they do is they look at your modified adjustment gross income on your federal tax return from 2 years ago. And if your MAGI from 2 years ago is above a certain limit, you will then pay an additional amount of surplus based on your income level. So that's to say, in 2023, they'll look at what your tax return was in 2021. In 2024, they look at your tax return in 2022. Know that Medicare is an organization within Social Security and within the federal government. So the government knows what your tax return figure is. You don't have to self-report that, other than the fact that you file a tax return. So You'll get an announcement or a letter annually. And if your income has gone up 2 years previously, you may be subject to paying an increased amount. I'm going to read from the changes here, but we can kind of go across. For if you file individually, last year was 91,000 or less. In 2023, that figure is now $97,000 or less. Filing jointly, it is now $194,000 or less. Filed married but separate, 97,000 or less. And because of the over estimation last year, this monthly figure has now gone down a little bit. You pay the $164.90 for that level. The next level is $97,100 to $123,000 if you file individually. If you file jointly, that figure is $194,001 to $246,000. Whereas last year it was $238.10. In 2023, that amount is $230.80. $114,001 to $142 is now $123,01 to $153. Filing jointly, it is now $246,01 to $306. And rather than the amount being $340.20, in 2023, it'll be $329.70. The next level, rather than $142,01, that is now $153,001 to $183,000. Filing jointly, $306,01 to $366,000. Your monthly minimum amount in 2022 is $442.30, whereas your monthly minimum amount in 2023 will be $428.60. Whereas before it was $170,01 to $500,000, that figure is now $183,01 to $500,000. And under filing jointly, it is now $366,01 to $750. File married but separately, $97,001 to $403. It was $544.30 in 2022. In 2023, it will be $527.50. The next and the final row, the 500,001 and above, 750,000 and above, and that figure is changed to 403,001 and above. Your amount will go from $578.30 down to $560.50. I'll also point out that the annual deductible in 2022 was $233. That annual deductible now for Part B is $226. And again, I point out that the spousal benefit does not apply for original Medicare Part B. Each of you individually are subject to these costs. If both of you are on Medicare and your income was above a certain level, each of you will have these income-related monthly adjustment amounts for your Part B monthly premium. So let's go ahead and advance to the next page. The Part D, that's prescription drug coverage. Your annual deductible, and I should point out here, the annual maximum deductible in 2022 was $480. Now, what this says is essentially that's the maximum amount that can be charged for deductible. There are some companies that will charge less than that. So that's why it's important that you do your research when you look at Part D prescription drug plans, because some might charge $480, some might charge $450, some might charge $350, and you need to be a good consumer and pay attention to these details. This annual maximum deductible in 2023 will increase from $480 to $505. But again, you need to do your research. That's the maximum amount that's available, and it may vary from company to company. Your initial coverage limit, $4,430 in 2022, is increasing to $4,660 in 2023. Then you go into the coverage gap known as the donut hole, and that is still a 25% factor. Once you're in 2022, you reach the catastrophic coverage stage. If your total expenses are $7,050, that figure is now increased to $7,400. Now, once you get into the catastrophic stage, in 2022, your generic and your preferred co-payments were $3.95. copayment. In all other drugs, it was $9.85. In 2023, the generic preferred copayment has gone from $3.95 to $4.15. And all other drugs, the copayment has gone from $9.85 to $10.35. So a small increase, but an increase nevertheless. Let's go ahead and advance to the next page. Just as we had the income-related monthly adjustment amount for your Part B, your doctors, and your outpatient, Medicare also assesses this IRMA on your prescription drugs. So I guess I'll quickly go through this again. 97,000, the first row would be 97,000 or less, 194 or less. That's going to be the PP, which is the plan premium. The next row, 97,001 to 123, 194,001 to 246. That is going to be your plan premium plus $12.20. So it goes from $12.40 down to $12.20. The next row would be 123.01 to 153. Individually, jointly, 246.01 to 308. That is going to be plan premium plus $31.50. So that's gone down slightly. The next row of for 2022 at 142.01, that is now 153.01 to 183. Individually, 308.01 to 366, filing jointly. That monthly IRMA is your plan premium plus $50.70. The next row, 183.01 to 500,000 for 2023, filing individually. 366.01 to 750,000, filing jointly. Filed married but separate. I should say that for the three rows above that, the non-applicable still applies. But when we get to the 183.01 to the 500,000, if you file married but separately, that is now 97,001 to 403,000. That is your plan premium plus $70 versus $71.30. For 501,000 above, individually, 750,001 and above, filing jointly, 403,001 and above, filed married but separately. That will be your plan premium plus $76.40. So as you can see, all of these IRMA factors have gone down slightly for your Part B prescription drugs, as well as for your Part B outpatient. Let's go ahead and advance to the next page. These I just want to point out, these are Part D benefits that have continued. A year or two ago, the senior savings model came into effect, and essentially that allows you as the consumer to offer, the Part D plans will now offer a month's supply of insulin to you for no more than a $35 a month copay. You need to make sure, this isn't every company, it's not every state, it's not every county. So pay attention to what is available in your state, your county, and Medicare changes basically per county. So insulin might be covered under that plan's formulary. It may not be covered under that plan's formulary. It may not be available in this county where it's available in another county. So if you are insulin dependent, it makes sense for you to talk to your Medicare insurance agent, or if you do your own independent research online or call companies directly. Don't assume that your insulin will be covered. You need to make sure that you're in a county in which it is covered, and that the insulin you take will be covered under that particular Medicare insurance company's plan formulary. And there are different types of insulin. So again, take a look at the type of insulin you take and make sure that it is covered by the Medicare insurance company that you purchase your Part D plan from. Your COVID-19, Medicare will continue to cover your COVID-19 tests, vaccines, boosters, if you're eligible. So let's go ahead and advance to the next page. And that's about it. I don't mean to be too short and too sweet about this, but if you have any questions, let me know. The annual enrollment period is October 15th through December 7th. Starting October 1, Medicare agents can start talking to you about new plans for 2023. but we are obligated, and by law, we cannot enter into an application with you until October 15th or later. So beware of, I mean, don't let an agent say, well, let's go ahead and sign this and get this taken care of, and I'll just date it October 15th. That's not appropriate. So make sure that you wait till October 15th to sign any paperwork. I thank you for attending. And if there are any questions, I'll try to answer if I can. And if I don't know the answer, I'll be honest and let you know that I don't, and I'll research it and I'll get back with you.
Looks like we had one hand raised. Hillary.
Hillary, if you want to go ahead and type your question either in the chat or the Q&A, please.
And then there was another question of how we can get copies of these slides. Natalie, can we send these slides to everyone who registered today?
Natalie can, or if they want to contact me at Scott Gidley at sbcglobal.net, they can. I also have a website, www.medicarelakeway.com, and you can go onto my website and ask for them to be sent to you, and I'd be happy to send them to you.
Okay.
And I say that with no expectation that I'll be hounding you and calling you as a prospect. And I like to educate my clients, and I promise I won't take a sales approach.
Yeah. There's one question here. Scott, how does this impact UT Care?
UT is in University of Texas Care. University of Texas and other companies will have pension plans. And under their pension plans, they typically allow you to continue your medical coverage by purchasing a Medicare Advantage plan that is provided by your former employer. So UT, ERS for people that are school teachers, City of Austin, other large companies that have pension plans will offer an allocation to you or will allow you to utilize money within your pension funds to purchase Medicare insurance. I would say, work with an agent and do your due diligence and research. I've found, and I've recommended sometimes, stay with your UT plan, stay with your city plan in other situations based on what their needs are and what the costs are. It might make sense to leave that group plan with UT or with ERS and purchase your Medicare insurance individually. So I can't sit here and say one is better than the other. It's all situational, and it requires an analysis. And I'm willing to do that with no obligation for anyone who would like that. And that being said, also know that a Medicare insurance agent can never charge you a consulting fee or an hourly fee or rate to do this comparison, this research, this due diligence for you. We must do that free of charge. And if anyone's trying to say that they want to charge you for that, that's illegal. And I dare say you might not want to continue talking with them.
Yeah. Scott, there's a question here. If you choose a Medicare Advantage program, does that mean you only have one coverage versus Medicare primary and then secondary insurance?
Original Medicare is Part A and Part B. And original Medicare A is hospitalization and inpatient. Medicare B is doctors and outpatient. Some people say, that's all I want. I'm going to take that. But know that anytime you go into a hospital or go into inpatient, you have to pay a deductible now in 2023 of $1,600. And if you have only A and B, Medicare will pay 80% of your doctor's expenses, and you're responsible for 20%. So there are then two avenues that you can pursue. One is you can keep your original Medicare A and B, and you add on to it a Medicare supplement, which is typically a Plan F, Plan G, Plan N. There are 8 or 9 or 10 different plans that are available, and they all have different alphabetic numbers. and they offer different levels of coverage. So it's important for you to look at those and decide which is the best fit for you. If you do a Medicare supplement plan, let's say you're turning 65 now, most people will look at the Plan G. And the Plan G will say, we will eliminate that $1,600 Part A deductible, but when you go see doctors or outpatients, you are subject to an annual deductible of $233 last year. I think it's $226 next year. So those you pay, but you don't have prescription drug coverage under that. You don't have dental, you don't have vision, you don't have hearing, and you need to purchase those separately. So if you're going to go by way of a Plan G, you need to purchase a prescription drug plan. Well, you should purchase a prescription drug plan. You may say, well, I don't take any medicine, I don't need this. In the future, if you ever need to take medicines and you then sign up for Medicare Part D down the road, you'll be subject to a late enrollment penalty. So that's your choice as to whether you want to incur that late penalty or not, but it might make sense to look at an inexpensive Part D prescription drug plan and know that in the future you can always change it during your annual enrollment period if your health changes or if your prescription needs change. The second avenue you can take beyond just the original Medicare Part A and B is the Part C Medicare Advantage plan. And that's an all-in-one plan that basically will put its arms around A and B and give you a prescription drug plan Part D, and will give you dental, vision, and hearing, and will give you over-the-counter vitamins and supplements. We'll provide you with chiropractic. We'll provide you with a Silver Sneakers health plan. But some people do that, some people won't. And it really is what's best for you. There are some limitations if you do the Medicare Advantage. Most of the larger companies now will have nationwide coverage to say that you're still in network. If you do a PPO plan, a Medicare Advantage PPO plan, and you're traveling out of the county, you'll find that you will still have a good level of coverage in the areas that you go. But I would recommend that if you're going to travel to go see family or go to an area, talk with your Medicare insurance agent or be proficient enough to go on to that company's website to print out a list of the hospitals, the clinics, some of the doctors that you might need to see in that zip code or in that area to know that they're going to be in that network. I certainly don't want someone to get caught off guard and go to some nondescript city and suddenly they got to pay out-of-network fees, which would be a whole lot more than in-network fees.
Good, thanks.
Does that answer the question, or still a lingering question?
I think that definitely, sheds some light on that question and answers it. There's a question about if you also sell long-term care plans.
Yes, I do. But that's separate from this discussion. And if you were interested in that, you can contact me separately from this and we can discuss it.
Okay. And then two more questions. Once Medicare becomes effective, what is the year plan by calendar year or one full year? An example, if Medicare begins March or April 2023. And then the second question is, can you continue your private dental insurance plan through the marketplace plan if you choose the original Medicare A and B?
If you're covered under the marketplace plan now, and you become Medicare eligible, typically the government will say you need to not continue with your marketplace and you need to go on Medicare. If you're going to do a Medicare supplement or Medigap plan and you're not going to have dental, a lot of companies out there, Aetna, Humana, United Healthcare, the big companies, provide separate dental, hearing, and vision plans, which you can buy individually or you can buy as a couple. So if you don't want to use the coverage underneath a Medicare Advantage plan and you want to have your own separate one, you can, but certainly compare what the benefits are and what the waiting periods are for the individual plans that you buy versus having that coverage underneath a Medicare Advantage plan.
Good.
And I'm sorry, what was the other question?
You talked about both
the dates, the effective dates.
Right, yeah.
Whether you, I mean, original Medicare A and B, once you sign up for it, it's forever. There's no change. You don't have to re-sign up for it. You get your red, white, and blue card. You have an effective date. That's good until the day that you die. If you do a Medicare supplement plan and a Part D prescription drug plan, those are guaranteed renewable, annually renewable. And what you look at every year is during the annual enrollment period, does it make sense to look at my prescription drug plan and do I have the best fit? Because prescription drugs will change every year. What you take will change every year, and how Medicare insurance companies categorize them will change every year. For instance, one year a company might have a drug that you take, and they use a tier 1 through 5 classification. It may be a tier 1 year, and it might cost you $14. The next year, that same drug may be changed to a tier 1 drug, and it may cost you $0. So it's wise every year, particularly to take a look at your prescription drug coverage if you do the Medigap plan. Your Medigap plans, you have a guaranteed issue from the time you turn 65 for a 6-month period, or if you continue on your employer group plan, and let's say that you don't retire until age 68 and you stay on your group plan, and then you want to go to a Medigap plan, you still have that same 6-month guaranteed issue where there's no medical underwriting regardless of what your medical conditions are. If you are in a Medigap plan and you're in it for a year and you decide, I don't like this company, the claims processing is not good, I want to switch, know that if you're beyond that 65 or your retirement date plus 6 months, you will have to go through medical underwriting if you have a Medigap strategy plan. If you do a Medicare Advantage plan, your Part C, those are always guaranteed renewable, always no prior medical conditions. You can go from one company to another and you don't have to worry about your medical history. And I would also point out that if you do a Medicare Advantage strategy, it's not a one and done proposition. Each year, companies will change their premiums, they'll change their deductibles, they'll change some of the benefits they offer. So it's wise every year, just like you have your car tuned up or you go in for an annual doctor's checkup, work with someone or spend 15 or 30 minutes comparing, here's what I have now, here are the doctors I see, are they all still in network? Here are the medicines I take, are they still the best fit for me? And an independent agent like myself or another one can help you quickly analyze, is this the best fit for you?
Good. Thank you. There's 2 questions about the Advantage plan. One is, it seems that the Advantage plans are heavily promoted by physician groups. Why is that? And then kind of to go along with that, Medicare Advantage plans are only for those doctors that take Medicare, and they're asking, is that correct? So can you speak to those 2?
Well, let me answer the first one, or the second one first. Most doctors, most facilities will accept Medicare. Now, some won't. Some will say we are private and we offer white glove treatment and we do not offer or we do not accept Medicare and you've got to pay us. So it's important to talk with your doctors and find out whether they do or they don't accept Medicare. With regard to doctors promoting Advantage plans versus Medigap plans, doctors don't get subsidized or they don't get any sort of benefits with regard to what they recommend. So if your doctor accepts original Medicare or whether they accept Medicare Advantage, it's really up to you as to what is the best fit for you. You'll find by and large that if doctors accept Medicare, they're probably going to accept the Medigap coverages. It is important if you're going to change to an Advantage or if you're going to start with an Advantage, share with your Medicare insurance agent, here are the doctors that I see. Here's my primary care physician. Here are the specialists that I see. Make sure that they are in network with the company and the plan that you select. And if they're not, tell your agent to do some more due diligence and research so that you can maximize if the doctors you go to are in network. If your primary care physician is in network, you're going to pay a $0 copay typically. If they're out of network, you might pay $20 or $30 for that office visit. If you go to specialists, You might pay $30 or $40 for that copayment if they're in network. You might pay 50 or 60 if they're out of network. So it's important to pay attention to whether your doctors are in network or out of network. And really just to go back to that point, doctors really shouldn't be trying to steer you toward a Medicare Advantage plan versus a Medigap plan. That's your choice. Okay.
That's good. Thank you for looking out for us in that. Yeah. And so another question is, if I take the Advantage at 65, can I later change to original Medicare later?
Yes, you can. But if you do that after that 65 plus 6 months or retirement date plus 6 months, you will have to go through medical underwriting. You'll have to answer all the questions about your medical background and your medical history. And companies will look at the prescription drugs you take. And some of those prescription drugs may be on a list to say, we have to decline you. And if some of the your medical history is such that that it's major, they may say, sorry, we're going to decline you. So so be wise about that. I mean, if you go into Medicare Advantage, and if you want to, you say, this isn't working for me and I want to go to Medicare Supplement, you need to do that within that 6 month period. Okay. If you start out with a Medicare Supplement and you then switch to a Medicare Advantage, most companies will allow you a 1 year free grace period to come back and say, this Medicare Advantage didn't work for me. I want to return to my Medicare Supplement. Your Medicare Supplement plans are going to cost you more money, but they also, you don't have to necessarily worry whether a doctor's in network or out of network. For a 65-year-old male, female, your range for a monthly premium for a Plan G could be $100 to $125 a month, depending upon the companies. And then your Part D prescription drug plans might cost you anywhere from $7 a month up to $35 a month. Again, depending upon deductibles and how they tier their drugs. Whereas most of your Medicare Advantage plans are going to cost you $0, $10, $15, $30 a month for most of your Medicare Advantage plans. Now, there are other Medicare Advantage plans that might cost you $60, $70, $80 a month. But again, the more you pay for that base monthly premium, then the lower your deductible might be, the lower your co-payments might be for your prescription drugs. So it's kind of a balancing act. If you want to pay more for a Medicare Advantage plan, you typically will get coverage that doesn't have the cost sharing factors that are higher. And if you want to pay less, you might pay a little more for your cost sharing factors.
That's awesome. So thank you for that. Next question, maybe looks like maybe our last, is please, no, actually we just got another one, but please distinguish between not accepting Medicare and opting out of Medicare.
Well, I think they're going to be largely the same. And I think your question is the doctors that you see or the providers that you see. Is that right? A doctor may say, I don't accept Medicare. I only accept private payment. In doing that, they're opting out of accepting Medicare as a payment plan for their services.
Right. Next question, are the co-payments for each doctor appointment with Advantage plans, are there co-payments for each doctor appointment with Advantage plans? For an Advantage plan.
Again, that might differ a little bit, and that's why it's important to do your due diligence. Most Medicare Advantage plans, if your doctor is in network, if it's a PPO plan or if it's HMO plan in their network, there'll be zero co-payment for your office visits with your primary care physician. If you're going to a specialist, an endocrinologist, an oncologist, a gastroenterologist, there could be a $30 to $40 co-payment if they're in network. There could be a $40 to $60 co-payment if they're out of network. So again, take a look at if you're being referred to a specialist, make sure that specialist is in network, and you can do that research by going onto that company's website on your own, or you can quickly call your agent and say, could you please do this research for me and take 5 minutes and tell me whether this specialist is in network or out of network?
Okay. Going back to that question related to not accepting it versus opting out, they just were writing a clarifying question. My understanding is that a doctor can say they don't accept Medicare, but you can still file a claim with Medicare. If they opt out, then you can't file a claim. Is that correct, Scott?
Essentially, yeah.
Okay.
Yeah.
Okay. What reasons would you select original Medicare? Is the primary consideration expense?
Original Medicare is something you have to sign up for in order to be able to get your Medicare supplements, whether it's a Medigap or a Medicare Advantage. So I guess you could say I don't want to sign up for anything. If you've worked and you've satisfied that paying 40 quarters of Medicare withholdings, you'll get a Part A, you'll get a red, white, and blue card that says you have Part A coverage. You could decide I don't want to sign up for Part B, I don't want to incur that expense, and then you won't have Part B coverage, which is doctors and outpatient facilities, and you will then have to pay the retail rates for that coverage. Can you opt out of A and B? I don't think you should. You certainly don't want to opt out for A if you satisfy that 40 quarters and you can get it for free. But you still would be subject to that $1,600 deductible. If you want to opt out of B, that's your choice. But if you don't sign up for B and then you decide down the road that you want to, there will be a late enrollment penalty to sign up for B in the future.
Yeah. And just to clarify that, if say you don't sign up for B until you're 72, how does that work? Like, isn't there some type of penalty for each year that you miss?
There's a percentage penalty, yeah, and that can become quite costly.
Yeah. So, and then with considering your original selection, would you recommend Medigap instead of Advantage? What does that look like?
I don't recommend either. I work with the client and find out what's important to them. I look at their medical situations. I see the doctors that they see, the prescriptions that they take, how often do they travel. And what I do is I always present the two side by side and say, in addition to you're getting original Medicare Part A and Part B, here's your coverage and here's the cost if you do the Medigap and Part D. And if you want to look at a Medicare Advantage plan, here are the cost sharing figures, here are the deductibles, here's the monthly premium, here's the scope of the coverage. And I present that to the clients and let them decide what's best for them. It would be remiss for me, and I think it would be out of line for Medicare insurance agents to say, this is better for you, or this is the best product. We shouldn't say that. We need to decide what's in the best interest of our clients. And you know this as well as I do, Jeremy, as an investment advisory person, we're subject to certain rules, and I abide by those same rules when it comes to Medicare insurance. And it's not just what is suitable for the client, but what is in the best interest of the client. I don't want to sell my client anything. I want to educate them as to what their options are and help them think through it to determine what is best for them.
Yeah, absolutely. We need to understand the whole picture and understand the situation before we can make any kind of educated possibilities. So
I'll share one thing with you here, and most people don't know this, that as an agent, we earn a first-year commission if we sell a Medigap or a Part D or a Part C. And then if we maintain that client in our book of business, we get a renewal commission each year that we keep them on the books. And typically that first year commission is about $560 to $575. And the renewal commissions are about $250 to $260. Medigap plans will pay the agent that renewal commission years 2 through 7, maybe years 2 through 8, after which time your Medicare agent does no longer receive a renewal commission. So there could be some unscrupulous Medicare insurance agents out there that might want to write you a Medicare supplement plan to start with, or see that you have a Medicare supplement plan and try to flip you into a Medicare Advantage plan so that they can continue receiving their renewal commission in year 9 and therever. Your Medicare Advantage plans will pay that renewal commission forever until the death of the consumer. So beware that that can happen. And if you feel like you're getting pressured into going to a Medicare Advantage plan out of a Medicare supplement plan with your same agent, it could be because they want to continue getting a commission. I'm not suggesting that, but that can happen.
Yeah, if you ever feel pressured to do anything, you just need to pause and
Exactly.
contact a member of our team with Lake Travis Senior Services and
Right.
let us help you kind of navigate that, because if you ever feel pressure, then it's just not worth making that decision. So,
and this pressured tactic selling goes back to the original rules we talked about, and that is we need to let them know with that disclaimer, we don't offer every product, and please go to 1-800-Medicare and go to medicare.gov and make sure that you understand fully what all your options are. And we need to say that this phone conversation or any communication we're having is going to be recorded, so that if we mislead someone or we misrepresent or we're trying to force a sale on someone, there's a recorded message where if you, the consumer, want to complain to CMS, that recorded message has to be there. And if the agent doesn't do that, then that agent will lose their license.
Yeah. Got a couple more questions. How does the deductible work for original Medicare Part A? It's a $1,660 deductible broken down by days 1 through 60, 61 through 90. And what deductible are you paying during these periods?
Well, you're going to have a deductible which is separate from your copayment. Let me go back to that page just so I can talk about the facts here. In 2023, anytime you go into your inpatient hospitalization, you've got a deductible of $1,600 that you just got to pay to go in. And then days 1 through 60, your coinsurance is $0. So in addition to that $1,600 deductible, if you're going to be in the hospital for 61 through 90 days, you're paying $400 a day in addition to that $1,600 deductible up front. And if you're going to go be there for 90 days, 91 plus, you'll be paying that deductible plus $800 a day.
Good.
So they are separate cost sharing components.
Okay. To clarify, Advantage plans will typically be less expensive than Medigap. Is that accurate?
It's all situational. I cannot say it's better. I cannot say it's less expensive. I can say that the monthly premium will be less, but you're going to have office visit co-payments pertain, whereas a Medigap that won't if you have a Plan G. You may have procedures, lab procedures, outpatient procedures that you may have co-payments for under the Advantage plan that don't exist with a Medigap. And if I can kind of use an example here, I've got a client that has psoriatic arthritis, and she is needing, the doctor's recommending an infusion therapy approach using a new specialized drug. Well, if they have a Medicare Advantage plan, they will be paying $700 every time they have that infusion therapy, and they need it every 6 months. So that's $4,200 a year that they're going to have for this infusion therapy for a specialized arthritis drug. If they have a Medigap plan, a Plan G, they will simply pay, if it's done in the doctor's office, the infusion therapy is done in the doctor's office, they simply pay that Part B deductible, which is $226 next year, as opposed to $700 6 times a year. So I can't really say one is cheaper than the other, one costs less than the other. again, it's all situational depending upon what your medical needs are and the procedures are. But I will respond that the base monthly premium for a Medicare Advantage plan includes prescription drugs within it and dental, vision, and hearing within it. So you're not having to pay separately for those. If you do the Medigap plan and Plan G, you pay a monthly premium for it. You pay a separate monthly premium for the Part D prescription drug plan. And if you want to have dental, vision, and hearing, you have to go and buy that policy separately, which would cost, again.
Yeah, that's good. If you have any other questions, you can reach out to Scott. His email is in the chat there. And Scott, would you mind repeating that for those who maybe didn't see it in the chat?
Well, it's my name and it's all continuous letters, Scott Gidley, SCOTTGIDLEY at sbcglobal.net. Or you can go onto my website, which is www.medicarelakeway, all continuous letters.com.
Very good. Thank you so much for the information today, Scott, and thank you for participating. It was a wealth of information. So I know that today was valuable for all of our attendees. And if you want to watch this webinar later, you can always go to YouTube and search for LT Senior Services. And there you can see all of our webinars that we've held. So thank you for joining us, and we'll see you next month.
Thank you very much. I appreciate it.